Vertical Labrets versus Labret Piercings. Pros, cons, advantages, disadvantages. Coming up next on Pros and Cons by a Piercer, episode number 78. So stick around. For those that are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So when I talk to you about these things, I'm talking to a level of expertise as someone who's been in the body piercing industry for well over 26 years. What we're going to talk about today is two particular piercings. Both of them are oral piercings. The first one being the vertical labret, which is done vertically through the center of the lip. We try to do it so that it looks dead center. Even though most people's anatomy is a little skewed one way or another, the idea is to do that. It's pierced outside the mouth more so than normal labret piercings. Labret piercings are usually done anywhere along the lower lip. They're done with a labret stud, and they are done horizontally, straight through the tissue. So what we're going to talk about today is I'm going to give you pros and cons. We're going to go through this. The design or idea behind this video is somebody that is maybe trying to choose between one or the other. I kind of broken this down, and I keep expanding it because I keep coming up with new things that I should probably be talking about. But we're going to cover some basic topics. The first one being anatomy, placement, piercing experience, healing, jewelry choices, living with the piercing, and the risks that are involved of having the piercing. So let's start out with anatomy. With the vertical labret, the lip needs to curve outward. The more curved out or pronounced that lower lip is, the better the outcome generally is. With the labret, basically there needs to be enough room in there for the jewelry and be able to place it in a way that it's not in direct contact with the gum line, either above or below. Preferably, in my experience, below works a little bit better. That moves us to placement. With the vertical labret, it is done vertically, of course. It's going to be just inside or just below the Vermillion border that if you pinch down, you'll feel like there's kind of a raised bump area on the edge of your lip. It needs to go below that, and then up into just inside, and I'm probably going to mispronounce this, the Tubercles, which is the part of the colored rough texture of your lip. It needs to be more into that smooth tissue on the inside. So kind of right at that border, about a 1/16 to an 1/8 of an inch below and outside, so that the jewelry is more outside the mouth. With labret piercings, placement is usually, like I said, we try to go below the gum line wherever possible, or above, just below that Vermillion border, straight through and perpendicular. If the tissue is like this, then we want it exactly like that, horizontally. Now that moves us on to the piercing experience. With these two piercings, the vertical labret, the forceps hurt a little bit, or a little bit uncomfortable, but usually it's not a very painful piercing to get done. Very quick. Usually the jewelry insertion is fairly easy depending on the type of jewelry that you choose or are having this done with. Very quick piercing, not really very painful at all. Regular labret piercings, just basically because of the method that we usually use with them, can be a little bit more uncomfortable. Of course, the forceps are going to be uncomfortable, but usually what we'll do is we'll pierce from the outside inward, then we will take a taper pin and push the needle out, then hook the taper pin to the inside of the labret stud, and then push from the inside, use some hemostats to hold it in place, screw that ball on. So it takes a little bit longer in some cases to do it. That can be uncomfortable. It can be uncomfortable to have people moving around or having their fingers in your mouth, and etc. But the actual piercing, about the same. Not really a very painful piercing to get done initially. It's more of the everything else that goes with it kind of situation. And that moves us on to healing. Both of these piercings, first off and foremost, are going to have a change in diet. They're gonna have to be taken care of on a regular basis. Swelling's always a factor anytime you do any type of oral piercing. Probably the most impacted would be any tongue piercing because that tends to swell a lot more. But any lip piercing or any piercing through the mouth, you need to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, or anything that may agitate your mouth. That's the case with both of these. Also, with both of these, you do need to practice a bunch of cross-contamination prevention. But unlike non-oral piercings, no deep mouth kissing, oral contact, or sexual contact until the piercing is completely healed. With the vertical labret, because it's located and positioned right in the center of your mouth, it can take a little bit of adaptation or get kind of in the way when you're eating. Some people experience it when they're drinking stuff. Usually doesn't affect speech, but that constant movement can be kind of agitating for some people. So there is a little bit of an adaptation as far as eating and etc. You tend to kind of shove things in and drink through the side of your mouth until at least the swelling goes down or until you can kind of figure it out. Labret piercings, not quite as complicated because they're usually kind of down and out of the way. It doesn't really affect eating and drinking the same way that a vertical labret does. You generally do want to kind of take it easy, stick with kind of simplistic foods at first to see what you can handle. The main concern with labrets is, especially if they're done really high, is that back catching on teeth. That can be very frustrating and annoying. And because of both of these piercings in the swelling, you're going to probably start with a piece of jewelry that is oversized slightly to allow for that swelling. In some cases, like with the labret, I'm more prone to go, yeah, we need to kind of put a slightly longer one in there. They tend to swell a little bit more than the verticals, in my opinion, or in my experience. So you're dealing with this longer piece of jewelry, which can be kind of a hassle during the healing process. And it will require downsizing once the piercing has healed. Or if you're getting it caught all the time, before the piercing is healed. Now let's talk about jewelry. The accessory reason why, or the main reason why people get pierced. They want to wear jewelry in it. With the vertical labret, you kind of have two jewelry choices, either curved barbells or rings, or circular jewelry. I guess you could wear circular barbells and other things. You need that natural curvature so that it fits better into that piercing area. Something straight is going to probably cause problems and put a lot of pressure on the piercing and possibly cause it to rotate or reject. That is kind of a thing with this particular piercing with verticals. Depending on the jewelry, you can have a flop one way or another, and they can migrate slightly a little bit one way or another. Generally, not a big thing, but it is also part of the healing process that I should have talked about. With labrets, you're pretty much stuck with labret studs, especially those that are done deeper into the mouth. You can, depending on your anatomy and the placement, in some cases get away with wearing a ring in it. Usually it needs to be something big enough to allow to wrap all the way around the lip, which tends to create kind of a bigger piece of jewelry. Some people have found like oval shaped or different shaped jewelry works pretty well in the piercing, but for the most part, you're stuck with labret jewelry. And there is a huge variety of different ends that you can wear on it. So I always say, if you go in and you're thinking about getting a labret or lip piercing, either or, which the labret, a lot of people just consider the center piercing, talk to your piercer about what type of jewelry your end goal is. If you want to wear rings in it or have that option, or you're more towards studs, talk to them about it because it should affect how they angle the piercing to make sure that you can wear the jewelry and also where they place it. Now that moves us on to living with the piercing. Vertical labrets, you are going to have to adapt to eating with that jewelry in and drinking and etc. That's going to be kind of a pain. It can get in the way even after the piercing is healed. Some people, you don't want to sleep on the piercing. That'll cause issues. There's a lot of different things that you're going to see change. But other than that, once you have this piercing, once you've adapted to it, you're probably not even able to notice that it's there. They just kind of become a part of your body. Of course, and this goes for both of them, Even after the piercing's healed, you want to practice safe sex when engaging in giving oral sex. Latex barriers like condoms, dental dams, etc. Even though the piercing's healed and it's no longer an open wound, it is a piercing through soft tissue with a hard metal object. Depending on how strenuous you get involved in that particular activity, there is always a possibility of causing a tear, and because that tissue's softer and it's scar tissue, it can tear. Then possibly you have an exchange of bacteria, STD, viruses, etc., and then you have something you didn't have before the encounter. So always practice safe sex until you've both been tested properly. Living with a Labret. Not as much of an adaptation eating-wise, drinking-wise, etc. as a vertical Labret. For the most part, you kind of need to take it easy at first, but it's out of the way. It's not going to bump into things. It's not going to affect things as much as having a piece of jewelry right in the center of your mouth in the front. The other thing about living with either of these piercings is you do need to consider that anytime you have a facial piercing, it is going to affect your ability to gain employment depending on your area of the world and how conservative the type of work that you do is. So always take that into account before you get a facial piercing or something that's on your face that's visible. There's no way to really hide these. Even if you remove the jewelry, there's always going to be that indentation scar. So if you're concerned about that, if you're really going to be going into a very conservative type of employment situation, it may not be the piercing for you. Risk. I've kind of touched on this, but let's get into it. The three main risks with any oral piercing is enamel erosion, gum erosion, and softening of the bones inside your mouth. And that's caused by the contact that the jewelry has with the structures inside your mouth. Everybody thinks it's from biting down on it, but it isn't. It's a constant rubbing and agitation. A lot of people will talk about, oh, well, wear plastic jewelry or this type of jewelry or this or that, and that's going to magically not make this happen. So none of that stuff is really going to reduce it all that much. It's still hard plastic. It's still in contact with the gums, and it's still going to cause erosion and etc. With vertical Labret piercings, because they're more outside the mouth, in any lip piercing that's done at that angle, you're not going to have as much contact with teeth and gums as you're going to have with having a flat disc on the inside of your mouth. They are a lower risk to enamel erosion, gum erosion, softening the bones inside your mouth. And because your lip is most curved outward, we can pierce it further out than we can with any other oral piercing. So it is probably the least risky of all the oral piercings that you can get done. With Labrets, like I've talked about, the nesting will help a little bit, but that constant contact on the inside of your mouth and having that disc there will eventually possibly cause problems. Anytime that you have, if you've been wearing a piece of jewelry for a long period of time and you're beginning to notice soreness or any type of damage, you should remove the jewelry as soon as possible. It gets easier, it's less of a, or it reduces it to go to the shorter barbells, or studs, but it doesn't always 100% guarantee that those problems aren't going to happen. Well, that's it. That's all I have to say on this subject today. I hope you learned something. I hope you found it edifying, enjoyable, entertaining, and I answered those questions you have. If I didn't, please leave a comment. I usually answer them when I have time. Even if it has nothing to do with Labret piercings, I'm generally, if it has to do with piercings, or you just want to say hello, I'll generally answer. Until it gets to a point where I can't anymore, because there's too many of them. If you are new here and haven't subscribed already, do please subscribe, hit that notification bell so that you're notified every single time we post a video. We generally post between 4 and 5 videos a week, all of them about tattooing and body piercing, and all with a focus on education. If you like swag, you like t-shirts, you like phone cases that are unusual and unlike any other ones, or maybe you need a new beach towel, check out our merch store. Roughly about a dozen different designs there. You can get them in various different colors, and of course, a lot of different products. Also, there's a merch bar below that gives a kind of a basic idea of some of our designs. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see if your body piercing needs in the future. Thanks for watching. I hope you enjoyed it. As always, stay safe, do something fun, but do it safely, and stick around because we like you in the world.